Welcome back, guys, to the Not So Fair But Lovely podcast. Today, again in the house, we have the lovely resident dermatologist, Dr. Soma. Welcome back, Dr. Soma.
Thank you, Ramona, and welcome to all my audiences to this podcast.
Fantastic. Today, we're actually going to be diving into a topic that is very close to my heart, something that I'm very passionate about. And we're going to be actually busting myths around, do Indians or people of color need to wear sunscreen? I'm sure, Doctor, you've got some amazing insights and expertise that you're going to bring to the discussion today. And I really want to just kick off with a little bit of an outline about what we'll be looking at today and just starting with some basics. So, Doctor, can you explain to our audience what are the differences between a physical and a chemical sunscreen?
Okay, now the first thing first, as you said, sunscreens. Irrespective of your
Mm-hmm.
skin color, you have to use a sunscreen indoors and outdoors and for every skin of color. Now,
Absolutely.
coming to types of sunscreens, yes, as you rightly mentioned, there are two physical, as in two blockers.
Mm-hmm.
One is a physical blocker and one is a chemical blocker.
Right.
Now, physical blocker, that is a physical sunscreen, is a sunscreen which forms a layer outside your skin and
Okay.
it reflects the light.
Mm-hmm.
And that is the way it protects you from the sun rays, UVA, UVB,
Okay.
or the infrared and the blue lights.
Mm-hmm.
And the chemical sunscreens, they have a component which basically gets absorbed into your skin
Yes.
and then it reflects light. So these are the basic two different component or types of sunscreens available.
Okay.
The commonest example for a physical sunscreen is
Mm-hmm.
if you have ever seen the cricketers playing on ground, they
Absolutely.
have these physically, visible white color patches on their faces.
Is that a zinc base? Is
That's
it a
the
zinc base, Doctor?
Yes.
Yeah. Okay.
So that's the classical physical sunscreen, which basically is a combination of titanium dioxide
Mm-hmm.
and zinc oxide. So nowadays we get formulation where companies play around with this concentration of zinc and titanium.
Mm-hmm.
Also, for the fact so that this appearance of white cast is not there
Mm-hmm.
and it is aesthetically accepted by a lot of people.
Absolutely. I think gone are the days when we used to think that, especially if you look at the Australian cricketers, used to have it across their noses the entire time. Back in the 80s and 90s when they used to play cricket, that was a real, telltale sign of applying sunscreen. So I know absolutely what you're saying there, Doctor.
Yes.
And I just want to understand from you. I mean, obviously, as far as my knowledge goes, it's not one is better than the other. It is whatever you will wear on a daily basis is the best sunscreen for you. Am I correct in saying that?
Yes, absolutely. The sunscreen has to be chosen, and you nowadays,
Mm-hmm.
the best part is you have the choices for it.
Absolutely,
You know,
absolutely. And Doctor, can
yes.
you tell me, I mean, looking at overall skin health, I mean, we know some of the obvious detriments that can happen to skin, including skin cancer and other UV damage. But can you just go into a little bit of depth when we're talking about people of color and in particular Indian skin tones? What are we looking when we're talking about not wearing sunscreen? What damage can occur to our skin health if we don't use it on a regular basis?
So, when you don't use your sunscreen, basically what is happening is because of the sun rays and the visible light, there
Mm-hmm.
is a little bit of disturbance in the pathway of the melanin. Now,
Mm-hmm.
let me just go to the basics here to start off.
Absolutely.
What happens is that there is a color pigment known as melanocyte,
Mm-hmm.
which produces melanin, and this transfers the melanin from your deeper skin to the superficial skin.
Okay.
Now, when due to the damage of sun and visible light, this transfers get affected, and then there is a collection of this melanin which is unevenly distributed into the superficial skin,
Mm-hmm.
which then reflects as pigmentation. Okay,
Mm-hmm.
so that is one cause of it. Secondly, is because the sun rays and again visible lights and all the environmental damage to your skin, because if you're not using a sunscreen,
Yes,
your aging is going to set in faster. That
absolutely.
means your collagen and elastin is going to break down faster.
Mm-hmm.
The moment that happens, again, there is a disturbance of the distribution of melanin into the skin,
Mm-hmm.
and you will start getting pigmentation around. So the most common damage of a not wearing a sunscreen
Yeah.
starts with a uneven pigmentation on skin, especially around the mouth and around the eyes and on the forehead. Second, you can start having premature aging.
Mm,
Fine lines, wrinkles, damage to collagen and elastin can start happening. You
absolutely.
can also get solar lentigen sunspots. Okay, these are again patchy pigmentation which is commonly seen on female or a light skin patient or any skin of color.
Mm-hmm.
Also, there is a one more thing which is very common in skin of color is melasma,
Mm-hmm.
which is a hormonal based pigmentation.
Okay.
But if you don't wear your sunscreen, you're going to aggravate this condition,
Right.
and this
Right.
condition is going to grow more severe, widespread on your face.
Absolutely.
Obviously, apart from this, you also get a common pigmentation which we call as tanning. And tanning once becomes like, if it's acute and you take care of it, it's still fine. But
Mm,
if you do not use a sunscreen and if you keep piling up the tanning and it becomes chronic, then it really becomes a difficult pigmentation to handle. So these are
mm.
few things which we commonly see across our patients as when they are not using any kind of sunscreen or any kind of sun protection on their skin.
Yeah, I mean, this is really interesting, Doctor, because I think I grew up in Australia, and from my understanding here, the UV rays in particular, we have less ozone protection here, are very harsh. So,
Yes.
even if the temperature may be in the low 20s, when you're out and about, and the lifestyle here is more outdoor as compared to, say, in India, and growing up as a kid, there was a slip slap campaign, which was basically to put on sunscreen, put on a hat, and stay out of the sun between the hours of, say, 12 and 3 when the rays are the harshest.
Yes.
But I think there is a lot of misconceptions, and this is something that I think I want to really touch on today, is that people of Indian origin, Indian skin tones, maybe from these sort of backgrounds. And I know that as a child, my mother never enforced this to me because I think she wasn't grown up that way. And there's a myth. And the first myth I really want to look at, Doctor, is that, when people say, look, I have a dark skin tone, so I don't need sunscreen. I mean, I know you've touched on that, but I really want to, hone in on that one because I think that is such a myth that people have. And like you said, people of Caucasian background will often want to tan, and that's seen to be something, desirable, especially during the summer months. You'll see people sitting in the sun, soaking in the rays.
Yes.
But obviously, Indians feel that they don't burn, they don't tan. So why do we need sunscreen, Doctor?
Now, as we said that Indian skin color, because we are full of melanin, which is supposed to be your natural sunscreen as well. But we again, coming back to the subject, we also have to understand that there is a basic mechanism from where your melanocytes make this melanin.
Mm-hmm.
As I said, these melanins are transferred to the superficial skin. But if your skin, if you're not protected, if you don't wear a sunscreen, the first basic thing is like any damage, pollution, sun rays, UVA, UVB, infrared, blue light is going to disturb this cycle of even making the melanin. It's
Mm-hmm.
not only about the transfer, but also about making this pigment.
Mm-hmm.
And again, the problem is that it is going to be unevenly distributed. The production of the melanin is going to be very, very uneven in ratios, and you might have a placement of this melanin in different layers of skin, which will give you again a patchy pigmentation. Apart from that, see, pigmentation is one part of sun damage, but the other
Mm.
major part is breakdown of DNA, which the UVA rays does mostly. So
Yes.
you will start seeing a lot of premature aging. You will start seeing photo aging, especially wrinkles around the eyes,
Mm.
especially your forehead or the lateral part of the face. There is a lot of sagging, patients losing a lot of luster.
Mm-hmm.
So these things have to be kept in mind, and that's the reason, irrespective of whatever skin color you are,
Yeah.
sunscreens are the bare minimum that you require on your skin. This is something which is very important.
I think this is such a key point, Doctor. And I think this is what people misunderstand is that sunscreens, like you said, are an anti aging preventative. And this habit, I guess, if inculcated from a younger age, will slow the effects of aging on the skin. And I think that's, especially for people of color, that's something that they really need to consider because although we don't face exactly the same, issues as Caucasians, we have other issues to contend with. Often I know I hear people saying another myth that people say is that, I don't spend much time outside, so I don't need sunscreen. But doctor, am I correct in saying that, the UV rays, even if you're sitting indoors near a window or whether you're driving, can still have a similar effect, doctor? Is that correct?
Absolutely right, Ramona, because as I keep emphasizing, when we are outdoors, it is mostly the UVB. But
Yes.
when you're indoors, it's mostly the UVA, not only in the form of sun rays, but you also have these lights
Mm-hmm.
on your desk. You have computer
That's right.
screens, you have your phone screens. People are cooking in their houses using all the gadgets which are emitting rays. So
Absolutely.
these are much more dangerous, acute with a narrow bandwidth, because of which the penetration of these rays are pretty deep into the skin,
Mm.
and that's what changes the whole DNA make of your skin, giving you a bad skin, actually, in a layman's term.
Mm-hmm.
So you have to wear your sunscreen irrespective if you're outdoors or indoors. You will have to wear it daily. It's basically like having your breakfast,
Yeah,
that you can't
absolutely.
skip your breakfast, and you have to eat your breakfast every day. And that's how the sunscreens work. You have to use it from the sunrise to the sunset.
I think that's a great way to look at it. And I mean, it's definitely something that I have introduced into my daily skincare routine. And, I feel that even for my children, I have sunscreen near the front door that they apply to their body because obviously they're out in the sun a lot here in Australia.
Yes.
Doctor, one thing I want to ask you, just going back to that point, where in the routine, when you're applying your morning skincare, so whether it's serums or cream, where does sunscreen come in? Is it at the last step?
Yes. So I'll just explain you in a brief, Ramona,
Yeah,
when we are talking, because nowadays we see our patients also, they want to use a lot of stuff on their face, especially when it comes to serums and moisturizers and
correct.
cleansers, right? So the basic routine should be, obviously, first is cleansing.
Mm-hmm.
Then, if at all you're using an active, like a hyaluronic acid or a vitamin C
Mm-hmm.
as a serum, which has to go first on your skin,
Mm-hmm.
then you seal this with a moisturizer,
Yes.
and then the last layer should be your sunscreen.
Okay.
It can be either a chemical sunscreen or it can be a physical sunscreen. That also depends upon how the patients want to be used to it. As in, as I said, if somebody is too much outdoors, I would rather prefer a physical sunscreen. But
Mm-hmm.
if the patient is normally indoors, not much of outdoor person, then a chemical sunscreen would also serve as the best.
Wonderful. And doctor, just on that point, I mean, I see, in the market you get a lot of moisturizers that have SPF 20, SPF 15, but ideally, what should we be looking for? Should it be an SPF 50 rating, UV? I mean, guide us through that a little bit and tell me, like, what is
Yeah.
the optimum sunscreen that we should be looking for?
Okay, so now the whole point here is that when we are looking at a sunscreen, what is the ideal sunscreen that one should pick up?
Mm-hmm.
Now, the basic few points which always everybody, irrespective of
Mm-hmm.
the brands, they should look at it, that the coverage.
Yes.
Is it a UVA, UVB coverage? Is it giving you coverage to infrared and blue light? Also, for the fact that we require to see the SPF, the sun protection factor, which should be minimum 30. Now, why minimum 30 and why not 50, not 20? Because, for example, someone might come and ask me, Doctor, I'm all the time in the house, so I think 15 or 20 SPF should do me the job.
Yeah.
But we have to understand that physiology of our skin. When you apply a SPF of 30 for start as a minimum,
Mm-hmm.
please understand that you have body secretion, and the sunscreen is also going to get degraded after few hours.
Okay.
So first important thing, that your SPF is not going to be staying at 30 SPF throughout the day.
Correct.
It is going to get degraded as the days pass by. Ideally, the reapplication of a sunscreen, that's the reason we say, should be at 3 to 4 hours interval. Okay, so
Mm-hmm.
minimum 30 SPF is required to sustain the complete coverage. So an
Okay.
SPF 30 would give you a coverage of 99% from the sun rays.
Mm-hmm.
And by the 4 hourly, this is going to get lessened up. And that's the time when you have to reapply it.
Sure.
So if you go lesser than the 30 SPF,
Mm-hmm.
the coverage is not enough and you're not serving the purpose.
Okay. No, that's really good. That's really a good point. Yeah.
Yes, so the purpose here is that you should get maximum coverage.
Okay.
So SPF 30 minimum is a mandate in a sunscreen.
Okay.
Yes, obviously, we are lucky to have sunscreens which have more than 30 SPF. We have 50, 40, 70, and 100 available in the
Correct.
market. But at least if somebody has to start off and they are not too gung-ho about going up to 50, 30 should be good enough to start.
Mm. All right, fantastic. And another thing leading on from that, doctors, another myth that I think that we need to bust here is that, a lot of people say, look, sunscreen formulations are really greasy and are going to clog my pores. So that means that more often than not, people will actually opt out of using them. But I think nowadays, as you mentioned, doctor, there are a lot of new modern formulations, especially in the Indian market. I want to just touch a little bit on not necessarily particular brands, but more looking at the kind of formulations that are now available, and address the issues of white cast, because that's a big thing for people of color. That
Yes.
when back in the days when we used to apply sunscreen, it used to make our faces look grey,
Yes.
and a lot of people would not, obviously that's not a desirable look. So people would say, well,
Yes.
I'm not going to wear it because it doesn't feel good on my skin. It doesn't look good on my skin.
And I
It
look darker.
emphasizes my pores. Absolutely, doctor. So tell me now, I mean, obviously I know things have come very far, and which is exciting. But tell us a little bit more about the formulations that are now available on the market.
Yeah. So formulations have definitely evolved, Ramona, in these years, okay?
Mm-hmm.
As you rightly said, yes, we used to face a lot of problems with sunscreen application to our patients. They would come back to us and they would complain, that it is leaving a white cast, or it is making me look very darker than the normal skin color. And, it doesn't get absorbed. It's very greasy. People with oily skin would always have this issue. Male
Correct.
patients would always have an issue because of sweat and the sunscreen running down to the face and then to their clothes. So there used to be certain products with certain ingredients like PABA,
Mm.
which is now not present because that
Yeah.
was one component which would actually soil your clothes and it would stay in it. Okay. So now they have
Never even
improvised.
heard of that. That's amazing. Okay.
Yes.
Interesting.
So they have improvised into it. So now the shift again is towards the physical sunscreen because they are considered to be the good sun blockers. Coverage is better.
Mm.
So now the two components, which is titanium dioxide and zinc oxide, has been formulated in microsphere formulations.
Mm-hmm.
So what happens is that you do not get that white cast and they also give you the block.
Okay.
Secondly, we have sunscreens which has like deep panthenol and silicon based, which makes the sunscreen little more mattifying.
Mm-hmm.
So patients who have really oily and greasy skin can look at the formulations which have matte feel to the sunscreen.
Mm-hmm.
Then you have sunscreens also which are tinted in nature.
Correct.
Here, the titanium dioxide percentage is little more higher, which gets that reddish color tinge to your sunscreens,
Yes.
which are very, very good to apply
Mm-hmm.
specifically for people who like to wear makeup or people who have hormonal pigmentation like melasma. The
Mm.
coverage is better. For example, if somebody doesn't want to wear makeup but wants to hide that patch, the
Mm.
tinted sunscreen is something which comes into handy. Second, we also have a lot of spray sunscreens available. The
Mm.
only issue with spray sunscreens are that if they are alcohol based, you have to be
Mm.
little careful of where are you applying it, as in are you near any flammable object, because it's alcohol, so you have to be little careful about the application.
Correct.
But again, as I said, you have sunscreens which are evolved so much, Ramona, that I can't tell you.
I
We
know.
have sunscreens now ingrained with a lot of components like ectoin, vitamin C,
Mm.
hyaluronic acid, vitamin E.
Mm.
Sometimes the sunscreens also work as an antioxidant. They are working as moisturizers as well. They are working as anti-pollutant as well.
Absolutely. I mean, I definitely have seen so many interesting formulations. I mean, including with niacinamide. I mean,
Yes.
obviously, I think this is an episode that we'll have to do an episode to dive into the brands that are out there. There's something interesting you touched on,
Yes.
doctor, which I hadn't actually thought about. Was about here we are obviously looking at women as an audience. So we're talking about application under makeup and all these sort of things. But the one you mentioned with men and sweating, because I
Yes.
know for a fact that a lot of men that are in my life, and they may be doing a lot of outdoor work in countries where the sun is even harsher, Africa and these sort of places,
Yes.
and they don't use basic sun protection. So I'm talking like hats and these sort of things. And even men are
Yes.
subject to obviously melasma, pigmentation issues. So I want to say, when you're talking about the sweating thing, there was a really interesting point, because I think we can't disregard that if women are not comfortable wearing something, and men obviously have issues around whether it's facial sweating, like you said. I think this is something that applies to all sexes. Both sexes have to be wearing
Yes.
sunscreen.
Yes, yes, absolutely. And that's what I said. So we have now a lot of formulation which suits each kind of skin.
Mm-hmm.
And so somebody can use a physical sunscreen, somebody can use a chemical sunscreens, and sunscreens which are matte based, water based, not being greasy, not being difficult to apply, not feeling heavy on the skin. Now, I'll just touch base on one point here,
Mm-hmm.
Ramona, that the commonest complaint you will be very surprised to know is, as I said, is that people, the moment they start using sunscreen, the first thing they come back and tell you that I'm looking a shade darker.
Yes.
So why does this happen? Now, it's because when you're using a sunscreen, see, it's a layer. So you will have to let it seep in and let the skin accommodate it. There is an adaptability period.
Okay.
Okay. So till that time, your skin might reflect the light and you might feel that there's something on my skin which is not reflecting my original color.
Mm-hmm.
Okay. But this is only a transient phase. Once you start applying a sunscreen, within a week's time, you will be adjusted and your skin will look absolutely normal after some time. The
Wow.
biggest mistake what people do is that they apply a sunscreen and they just step out.
Mm.
That's the wrong way of doing it.
Yes.
You have to apply your sunscreen in the right quantity
Mm-hmm.
at least 25 to 30 minutes before you step out of the house.
Wow, that's so interesting. That's something I never actually realized or observed. But absolutely, I mean, I think one thing is actually applying it and letting it absorb and sit into the skin before you put on your makeup. But like you said,
Yes.
it's something that a lot of people find it puts them off using it on a long-term basis because it changes their appearance in the initial stages. That's a very interesting point and something that I think people can learn a lot from and hopefully, persevere with the sunscreen of their choice. I
Yes.
want to just go back really quickly, Doctor, before we wrap up, and just summarize some key points for us, and also just outline what are some safe sun practices that all of us, regardless of age, gender, can do on a daily basis to make sure that we're being sun smart and that we're taking care of our overall skin health.
Okay. So again, as a doctor, I would come back and always emphasize on using a sunscreen. I always tell my clients,
Mm.
if you skip everything else, I'm still fine with it, but
Yep,
don't skip your sunscreen.
I love that. Yep.
That's one. So you will have to start looking at a sunscreen, as I said, with minimum SPF 30,
Mm-hmm.
with a broad spectrum coverage, should have more of physical sunscreen,
Okay.
UVA, UVB, and infrared blue lights. Okay.
Mm-hmm.
These are the basic component which would like to be in the sunscreen.
Okay.
Now, sunscreen has to be applied once daily in the morning.
Mm-hmm.
For example, if you're being outdoors for a jog and you've come back home, you have to wash your face and reapply it.
Okay.
So this is some one practice that you have to keep in mind.
Mm-hmm.
Nowadays, you also get sunscreen in the powder form.
Yes.
Okay, for people who wear makeup
Yeah.
and they want to reapply the sunscreens. For example, if you're outdoors and you can't wash off your makeup, right? And but you
Correct.
want to reapply your sunscreen, then there is a feasibility of using sunscreen which are in powder forms, which you can just
Mm.
put on your face and carry on your work.
Correct.
Obviously, you have to ensure that there is a lot of other sun protective gears like wearing big layers or wearing a hat, covering your exposed part, like whenever you can wear
Mm.
clothes which are closed, full sleeves. There are clothes nowadays available with sun protection factor. I'm sure
Absolutely.
you know about this.
Absolutely.
Yes. So you can use this. Try to avoid too much of tanning in the sun. Obviously, some
Mm-hmm.
people would definitely like to do it, but if you are in the sun, repeat your sunscreen. Even if you're in the water, the sunscreen time is 40 minutes. After that,
Yes.
you have to repeat your sunscreens. This is something which everybody of us should keep in mind while you're swimming, while
Definitely.
you're on the beach, while you're on doing any sports. So where you have to use your sunscreen every 40 minutes.
Mm.
And I think that should be to sum up with, so Ramona, more or less, that sunscreen nowadays is available for all age groups as well. So
Definitely.
you have sunscreen which are suitable for the kids, and you have sunscreens which are suitable for an acne prone skin, for a pigmented skin, for an adult man and a female as well.
Absolutely, Doctor. And I think, thank you so much for the discussion today. And I think there's been so many valuable things that I've learned out of a chat today. And I think, like I was reflecting on, you were talking about obviously making sunscreen a part of your daily routine, such as, having brushing your teeth or having a breakfast. And I would like
Yes.
to see this more. For example, I was thinking about the pandemic that we all recently went through and how, hand sanitation became such a norm
Yes.
and how it became something that you saw in every restaurant and every taxi, anywhere you went, there was hand
A hand
sanitizer.
sanitizer.
But I think that needs to be something that becomes so second nature to all of us, because, more and more so the environment that we're living in now, and we can see climate change and the effects it's having on,
Yes.
not just the weather patterns, but, our health. And I think we need to do whatever we can to protect ourselves. And this is something simple that we can do. And the message, I think, is really important to get out there that this has to start at a young age, to prevent the sun damage and to make sure that we can have the optimum skin health.
Yes, I'm sure, Ramona. I'm keeping my fingers crossed what you said,
Yeah.
that sunscreen should be available everywhere. I'm sure after our postcard, it is going to start.
Absolutely. I think we
Yes,
need to get a message out there. I mean, we still need to start a campaign and have
yes,
billboards and make sure that people be sun smart. So
sure.
thank you so much for your time today, Dr. Soma, and I look forward to our next discussion where I think we're going to explore, what Indian brands are doing and what new sunscreens are available on the
Yes.
market. Thank you so much, guys, for joining us today.
Thank you, Ramona.